to control your own health. All of them add layers and layers of bureaucracy. Now, health insurance is one of the most heavily regulated things in the country. And it's every state regulates it on its own. And they get to regulate it extensively because over half of the people who have insurance never have to deal with state regulations. Because they're on Medicare, which is a federal program. They're on Medicaid, which is again a federal state program that doesn't have to deal with any of the state regulations. They get to do whatever they want with Medicaid. Or they work at a very large corporation that is self-insured, or a large institution that is self-insured, and so the only thing that they have to meet are federal guidelines because they qualify under a law called ERISA, E-R-I-S-A. Don't ask me what it stands for, it doesn't matter. It's a complicated thing that it just, it means that they get to avoid state regulations. And when you have all of those people taken out of having to meet state regulations, all of a sudden you've lost all of the major voices that fight state regulations just about any place else. Car insurance and property insurance are also regulated at the state level, but you buy that on your own, or you will buy that on your own. And so it's a much better market because you have 100 million drivers, 100 million homeowners, each making their own decision about where they get their car insurance or their property insurance. The individual market for health insurance is about 6%. So you've got about 9 million people in the state of North Carolina. You're talking about a couple 100,000 people. That's it. There's a reason why insurance companies tend to avoid states, because there's no way they can compete. And to give you an idea of just how bad some of these proposals are and what they can do, the Baucus bill and the other bill talk about actuarial value. Now, I don't know how many of you know what actuarial value means, but I've been studying healthcare for a number of years, and I never knew what actuarial value was until I started looking at these things and started asking questions, and then finally found the paper where it was created. Actuarial value is a new idea that just came out about a year ago, as far as I can tell, in a paper by a guy at a human resource consulting company, Watson Wyatt. And what actuarial value does is it shows you an apples-to-apples comparison of two healthcare plans. Because most of the time when we're shopping, those of us who do purchase insurance, those of us in that 6% who purchase insurance in the individual market, when we're looking at purchasing insurance, we're looking at the deductible and the out-of-pocket maximum, and we're looking at the premium. And for a lot of us who have switched over to a consumer-driven health plan, a high-deductible plan with a health savings account attached to it so that we get to spend our own money on most of the things, and then we have a program, and then we have insurance to back us up if something goes really wrong. When we take a look at that, we take a look at the premium and we compare it to the premium that we were paying under our old plan and saying, boy, we got a huge savings there. And then we take a look at the deductible and say, well, the deductible I can manage. And I can even set aside some of the premium savings that I have, put it into my health savings account, and deal with most of the costs that I'm going to have during the year, because there's no way I'm going to reach that deductible and I'm not going to worry about that. Unless something goes terribly, terribly wrong. And I don't know about you, but I don't really like to think about things going terribly, terribly wrong. So I always assume I'm going to have low costs. And so far, things haven't gone terribly, terribly wrong. And so I've only had to worry about those standard costs. But you set the money aside, and you take a look at it, and then you take a look and you say, okay, the out-of-pocket maximum, well, I can, either I can set aside some money, or I can borrow something and be able to make up for that. But this brilliant man, PhD, obviously brilliant, right? I don't have one, so I'm jealous. He came up with this idea of actuarial value, because you take a look at a plan, you take a look at what it covers, and sometimes the deductible doesn't tell you everything. And so he came up with this way that you combine them and you do all of this stuff. The interesting thing about it, I've already gone into way too much detail about it, but the interesting thing about it is that the bills that are out there, the one says that the minimum acceptable, creditable health insurance coverage has to have an actuarial value of 70%. Medicaid pays for everything and the individual doesn't pay anything out of their own pocket in some cases, in most states, especially on the children's side. That is 100% actuarial value. So of all the costs that are being paid for health care, they say 100% has to be paid. 100% is when the insurance pays for everything. 70% is what they say is minimal creditable coverage in one of the bills. 65% is what it looks for in one of the other bills. And Mr. McDevitt, Dr. McDevitt, who created actuarial value that these bills reference, took a look at 32 plans in Los Angeles County in 2006, just to give some reference for how actuarial value works and where plans fall out. He looked at 32 plans. Of those 32 plans, 5 of them had an actuarial value of 70% or greater. 5 out of 32. About me. Then he took, what you think about that, 70% might be a pretty high bar. He took a look at going down to the 65% bar though, it only adds like 2, maybe 3 health plans. So 3/4 of the plans that he looked at using e-health insurance in Los Angeles County did not meet the minimum creditable standard according to the health care bills being put forward in the Senate and the House. 3/4 of people who purchase insurance on their own will have insurance that doesn't count as insurance anymore. People in Massachusetts have already run into this problem. They have had, friends of mine have had, parents of a friend of mine have had insurance for years. And when the Massachusetts reforms went into effect, they found out that they no longer had insurance. Now, there are grandfatherings that happen in the bills and all kinds of other stuff, but really, you may not be required to get new insurance. You may not be required to drop your insurance, but your insurance isn't going to count anymore for 3/4 of policies, taking a look at what's out there. The other aspect of it, and the other reason why I think healthcare needs to be in the hands of consumers, is really, are you going to trust these 436 people to make every decision about your life in a 1,000-page bill that, according to Representative John Conyers, there's no point in reading unless you have 2 days and 2 lawyers with you to tell you what it means after you've read it? Or would you rather trust yourself and trust the other 300 million doctors, patients, and families in the country to make individual decisions about what they think is a priority for their families, what you think is a priority for your family, what you think is a priority for yourself, and make those decisions on an individual basis, and have the government get out of the way. Doctors are only allowed to do certain things right now, and nurse practitioners are only allowed to do certain things, and anesthetists are only allowed to do this, and nurse anesthesiologists are only allowed to do that. And you end up with, instead of a healthcare market, you end up with a lot of little sandboxes that nobody wants to share.